Okay. Good morning. Sorry about that. My computer decided to have a little hissy fit this morning and not work. So let me just see if anybody jumps on, if we have any questions right out the gate. Um, yeah, gotta look at that. Okay, let's see what's going on here. All right, so let's start with a little disclaimer. A little background on me for anybody who doesn't know me. I'm a physical therapist. I've been practicing for 10 years. I have my doctorate in physical therapy. I have treated people with pelvic floor dysfunction over the years. I am not a pelvic floor specialist. That doesn't mean that I don't have a really good insight into what's going on with the pelvic floor in a general practice mindset. But there are some problems that happen with the pelvic floor that are out of my scope of practice. So this is sort of like a broad overview. It does not apply to everyone. Um, if you feel like it doesn't apply to you, I highly recommend that you see your OB, or you just go out and seek a pelvic floor specialist physical therapist to help you address some of the problems that can happen with the pelvic floor. Having said that, let's get into it and we'll see if anybody hops on with any good questions. So there are two major malfunctions. We'll go with that. It's probably not the right word, but we're going to go with it. That happen with your pelvic floor. And for anybody who doesn't know what your pelvic floor is, it's the group of muscles that's awful that make a bowl in your pelvis. And so they attach inside your pelvis to muscles from your pubic bone in the front to your tailbone in the back and right through the inside of your hips. And they support everything inside your body. They hold your insides in and they maintain a tight seal to keep the outsides out to reduce the risk of infection. And, hold your pee in, all of those things. And so, when do we get pelvic floor dysfunction? Pelvic floor dysfunction can happen for any reason. From prolapse to trauma to injury to pelvic malalignment. So if your pubic bone or your pelvis gets out of alignment, think about it this way. If you have like a tight elastic band bowl and you shift where that bowl is sitting or where like one of the sides of that bowl is sitting, you get slack, right? So some of those elastic bands go on slack and some of those elastic bands get really, really taut. And so the same can happen with your pelvic floor. If your hips, who usually sit like this, get a rotation in this direction or a rotation in this direction or a rotation in this direction, or you have an upslip where one of the sides of your pelvis sits a little bit higher, all of that can affect your pelvic floor. So pelvic floor dysfunction can come from a back injury, from walking in a boot for a foot injury, and your pelvis is off for 6 to 8 weeks. It can really come from anywhere. Your pelvic muscles hold your body together, and if your body isn't aligned right, just like everything else, if you don't have that alignment, then you don't get that stability. Pubic symphysis instability specifically can make it feel like when you get out of bed in the morning, it can make it feel like you just don't have a sturdy base to stand on. And that goes hand in hand with pelvic floor instability, and you have to make sure that everything is lined up so you can address the big picture and get your pelvic floor strong again. So all of that aside, two of the major problems with pelvic floor dysfunction are either hypertonic, which is a really tight pelvic floor, or hypotonic, which is a looser pelvic floor. And different problems come with those. Some of them have a lot in common. Some of them have a lot of differences. So with a hypertonic or a really tight pelvic floor, you could have problems like pain with sex or insertion of a tampon. You could have problems like constipation, urinary incontinence, because if you think of those muscles being so tight, when you have pressure on it, when you have to urinate, and it's so tight, it doesn't have the flexibility and extensibility to contract and relax. it just waits until that pressure builds up, and then that urine comes streaming out. So that's another side effect of a hypertonic pelvic floor would be that you have like that fire hose urine stream, where you sit down to go to the bathroom and it's just crazy powerful pee stream. You can have pain at your tailbone, pain at your pelvis at front at that pubic symphysis bone, low back pain. It could be something that when you're sitting in a certain position, it really hurts. And when you change that position, you offload your pelvis a little bit, you get relief, because it could be tight in one aspect and loose in the other. It can go hand in hand with bloating and constipation. So if you think that your pelvic floor is too tight, a really good way to help sort of relax it is through diaphragmatic breathing. So if you are having incontinence, and you've been like kegeling your little brains out and doing all the things and holding your pelvic floor and it just doesn't seem to be getting better, take a break from those just for a little bit and try some diaphragmatic breathing. That will relax your pelvic floor. And again, this is not a fix-all for a tight pelvic floor, but it is a really good first step. And if you find that you're getting some benefits from it, that is a really good jumping point for going to see your pelvic floor specialist, or honestly, your physical therapist, if they have experience in working with the pelvic floor. If it's just, a tight pelvic floor from a malalignment, then your physical therapist can do their best to realign you, work on relaxation of the tight muscles, strengthen the global pelvis, and hopefully get that under control. Again, so we talk about when the pelvis is rotated, if you have an obliquity there, you can get tight on one side and slack on the other. That translates out to your global muscles too. So you can have a lot of tightness in your inner thigh muscles, your adductors. You can have a lot of tightness in your piriformis. Things that are pulling your pelvis in any direction can put a lot of strain on your pelvic floor. Our bodies are happiest when they're lined up well, when they're strong and stable in their base against gravity. And so if you have an obliquity there, I subluxed which is sort of like a mild dislocation, just sort of a shift, my pubic symphysis in the birth of my first child. And the level of instability that goes along with that and the effects on your pelvic floor are insane. And luckily for me, I have a great physical therapy team that I worked with for years who put me back together very quickly. But I had the benefit of knowing, right? So I was in the PT clinic with my 6-week-old, getting fixed because I knew what was wrong and I knew how to fix it. I think this health system tends to overlook problems postpartum especially, and we let them build up for years and years until they become big problems. It doesn't mean they're not fixable. It just means that it might take a little bit longer or a little bit more problem solving to find the root instead of just addressing the symptoms. So for all those new mamas out there, if you feel like something is off, get your doctor to send you to a physical therapist. If you live in a state like New Hampshire or Maine, we have autonomous practice. Just go find yourself a physical therapist that has clinical practice with the pelvic floor, and with postpartum work and all of those great things, and we can get you on the right path really, really quickly, as opposed to just feeling like you're spinning out. There are a lot of practitioners on the Seacoast that do at-home visits, myself included, which is, I'm telling you, with a new baby, that's money. That's the great stuff. But anyway, so if you think that you have a tight pelvic floor, there are a few things that you can try to relax it. One being diaphragmatic breathing. And diaphragmatic breathing is when you breathe out, you push in on your belly with your hands. When you breathe in, you fill your belly up. When you breathe out, belly goes in. When you breathe in, belly goes out. So we're not breathing from our shoulders. We're not breathing from the upper lobes of the lung. I'll put a link in here for diaphragmatic breathing for after, so it'll be a video that walks you through it. Another one is happy baby pose, which is when you lay on your back in sort of the birth position, pull your knees up to your shoulders and just let your hips fall out. That's a great way to sort of gently stretch out your pelvic floor, just open everything up. Child's pose is a really good way to open your hips up again, open that pelvic floor. Butterfly stretch, when you lay on your back and you sort of let your knees flop open. Adductors can be problematic when it comes to a tight pelvic floor. Your adductors are the muscles that bring your thighs together. So those can be really, really tight. Gentle massage to your adductors can help loosen that up before you do a stretch, or like a piriformis stretch where you pull your opposite knee to your opposite shoulder and just sort of stretch out the back of that hip. All right, moving on. Let's get into the hypotonic or the loose pelvic floor. Got my little notes here. Urge incontinence. Oh my gosh, I have to go right now. And then like a little leak, just a little dribble. And then you catch it, and then you go on. Sort of your body's like titrating out a little urine. Urine leakage when you laugh, cough, jump, hop, all of those things. Passing gas when you bend over. Bend over to pick something up off the floor, a little toot. All the kids laugh. It's very funny. But if it wasn't intentional, then maybe a little bit loose in the pelvic floor. If it was intentional, you're probably just a parent. It happens. Decreased sensation in the vagina, pressure with sex, a feeling of fullness in your pelvic floor, low back pain, or it could be from organ prolapse. So uterine prolapse, bladder prolapse. Sometimes when we have kids, our parts come out with them, and then everything sort of tries to take up space in your pelvic floor. Stuff that doesn't necessarily inherently and anatomically go there in the first place. There are a lot of treatments for uterine prolapse out there. A pelvic floor specialist is definitely the first place that I would go for that, to see if you could strengthen your pelvic floor and do your best to sort of get your assistive muscles helping to pull everybody back where they belong. A pessary, which is something that you insert up into the vagina, and that sort of holds everything up where it should be, so you don't get that load on the pelvic floor. It just sits up there and holds your bladder, your uterus, whatever it is that's putting pressure on your pelvic floor. It holds it in place. That's a really simple solution to a big problem for people who aren't interested in surgery but are interested in keeping their insides in and their outsides out. There is a sling surgery that they can do where they put a mesh in a sling and they sort of tack everything up. I'm not 100% on the success rate of those. I just don't know. And I don't know if that's like an internal or an external surgery. I'm sure if it's external, it's laparoscopic. But that is a really good conversation to have with your OB if you've tried conventional conservative measures, being physical therapy. So make sure that you get a pelvic floor specialist if you're having trouble with uterine prolapse or bladder prolapse, and have them address that. So, finding our pelvic floor. How does your pelvic floor feel when you contract and relax it? So, the test, and I almost hate to say this because, full disclaimer on this, do this one time and then do not do it again. When you sit down to go to the bathroom, pee, and then stop your pee. One time. This is not the exercise. You should never be sitting on the toilet, starting and stopping your pee to make sure that you're working your pelvic floor. That is a really good way to coach bacteria up your ureter and into your kidney and give you a nice bladder-kidney infection combo. So one time, sit on the toilet, pee, stop your urine stream, tighten your pelvic floor, like almost like you're holding in gas, or like you're lifting up your pelvic floor like when you have an orgasm and it lifts up. That feeling is the feeling of you controlling your pelvic floor. One time. And then let the pee out. Don't do it again. Okay? Once you know what that feels like, you are good. Again, we do not want to start and stop our urine stream because that creates infection. It just coaxes whatever bacteria is around your toilet right up into your body. Anything on your body just coaxes it right in. Not a place we want to be. So that's not something we're going to do on a regular basis. Once you get the feeling of that pelvic floor contraction, I want you to lay down we're going to take gravity out of this. So when we're upright, gravity is pushing everything down, as it should. That's where gravity is. It helps us stay upright in space. Thank you. If we have good posture. But if you lay down, you're going to take gravity out of it. And then I want you to just contract and relax your pelvic floor. Contract and relax. So I want you to imagine that your pelvic floor is an elevator. For any men that are watching this, similar for you, you actually have the ability to control what direction your penis goes in with your pelvic floor. So that's a fun thing to practice. Trying to get your pelvic floor isolated so that you can pull your penis to the left, pull your penis to the right, pull it forward, pull it down. That's a really great way for you to practice getting your pelvic floor contractions. For women, we don't have the external appendage, so we have to sort of visualize what's happening. Now, you can take a mirror, you can look at your pelvic floor, watch it lift up into your body when you contract it, if you need that visual feedback. You can put your hand there, you can feel it lift up into you, or you can use your imagination. I like to think of my pelvic floor as an elevator. My elevator is at rest on the basement floor. When I need to contract my pelvic floor, I take it up to the 3rd floor. All the way up we go. So contracting that pelvic floor in a lying down position on your back, everything relaxed. Your butt does not move with this. Your abs do not move with this. Your thighs do not move with this. You should be able to isolate your pelvic floor so that you can do them anytime, anywhere, and nobody would even know. Very cool. So, not that cool. Nice party trick that nobody will ever know about. So I want you to just practice contracting, relaxing. There's no hold here. You're just going to tighten it and you're going to relax it. What's probably going to happen is you're going to tighten it 1 or 2 times and then it's going to get stuck up at the top because it's not strong yet. So it's going to fatigue out really, really quickly. And then I want you to do that diaphragmatic breathing, relax everybody down, and try it again. Contract, relax, contract, relax. Once you get the hang of this, I want you to Kegel 15, 20 times anytime you're laying down. Throughout the day, go take a break. Kegel. The second type of Kegel is called a quick flick or a fast contraction. So you have your quick flicks are great for incontinence. So it's like it helps override the autonomic nervous system. So when you have that urge to pee, your body sends that signal right to your pelvic floor. Your pelvic floor relaxes a little bit, lets a little dribble out because your brain is getting the sensation that your pelvic floor or that your bladder is so full you're about to explode. It's a fail-safe for your body. If you can do 5 quick flicks, 5 or 6 quick flicks, which is really hard to master. If you get 1 quick flick where you can relax and contract and relax really quickly, you're in good shape. But so your Kegels are your slow, and then you're gonna hold it, and then your quick flicks. It's just working a different type of muscle fiber, but it's really good for helping you sort of override the I have to go signal, so you don't in fact have a leak. You make it to the bathroom on time. I'm not saying that's an override for like, oh, I can go another 3 hours. You should be peeing I think it's every 2 to 4 hours. Hold on, let me check my notes on that. But I think every 2 to 4 hours. And you should be peeing for 20 seconds. 20 Mississippis. 20 1000s when you pee. Average. If you're peeing for 1000, 2 1000, 3 1000, and then you're done, you have inadvertently trained your bladder that it needs to empty before it does. We will get into that in a whole nother video because I think that's really important for us to know about how to hold our pee and how much we should be peeing. But we're hitting the 20-minute mark and I got a boogie, so I think we're going to leave it there. So strengthening, global hip strengthening will help with your pelvic floor if it is loose and you are misaligned. You should get checked out. If you feel unstable, just get checked out by a physical therapist. It doesn't have to be a long process. You can get 1 or 2 visits, get yourself aligned, get some knowledge, and then work on it at home. or go see a physical therapist, get a right and proper treatment, get yourself fixed up, and go live your life. Any questions you guys have, throw them in the comments, and we'll see you soon.